My name, everybody here knows. My name is Lee. I do marketing, and in conjunction with Eddie Travis, our new chef, and Dr. Cecilia Keady, we are putting on a heart healthy cooking educational class for February, which is National Heart Month, and it's also Valentine's Day. So kind of killed two birds with one stone on that. But to do some introductions, we have Eddie Travis, who, as most of you know, started with us in November. He's been doing a fabulous job. We're super excited to have him. He's got 25 years of experience, and lucky for us that he does. And then Dr. Cecilia Keady, who is a doctor and nurse practitioner. Her and her husband run the Keady Family Practice, which is here in Newport and also in Charlestown. And they're doing a wonderful job about getting some community services out into the community. And Dr. Keady's had extensive educational and training background in things like diabetes and high cholesterol and things of that nature. So Dr. Keady and Chef Eddie here are longtime friends, and this is why this kind of sort of presentation is close to their hearts, so to speak, because they both met because they were both having they were having issues with being overweight and eating healthy and getting healthy. So working together, I think it was at Springfield Hospital, yes. Was it? They met and realized that they could help each other, get heart healthy. So after years of friendship and working together, here we are. So I'd like to introduce Dr. Keady, and I'll let her take over from here.
Thank you. Well, good afternoon, everybody. Good afternoon. I'm very happy to be here today. I used to do a lot of community talks when I used to work for New London Hospital. We did a few senior centers, and my seniors always enjoy the talks. It could be spring, it could be near Christmas, but it was just nice to have all of them at once and kind of speak to them about something really important. So today we're going to discuss our diets, and the most important thing is cholesterol. So I just want to know how many people in this room take something for cholesterol. Okay, something. Could be fiber, could be fish oil, could be red rice, could be anything.
I take fish oil.
Okay, all right. Anybody else? No? Okay. And why do you think we have problems with cholesterol? Everybody has problems, huh? Okay. Now, why are we worrying about cholesterol? Why is it something that we need to kind of pay attention a little bit? Anybody know? Is it something?
It clogs our arteries.
It clogs your arteries and leads you to have what happens if we don't take care of those arteries?
It blocks the blood. You don't breathe well.
You don't breathe well. Very good. Does anybody here have high blood pressure? Mm-hmm. All right, we got 2 people. And how many people have diabetes in this room? Okay, well that's an area of expertise that I have. I love diabetes. I'm not diabetic. My mother is diabetic, however, and everyone in her family are diabetics. I come from Peru, where a lot of the medications and a lot of the things we have here, those people don't have it. So unfortunately, one of my uncles lost his eye, my cousin lost his foot, and just because lack of care. We do have a lot of things in the States where we can actually do something about it. And this is why it's so nice to learn about these diseases and what we need to do. So you hear cholesterol. That sounds like a dog's name, right? Cholesterol, cholesterol. What does it sound like to you, cholesterol, right? So what is cholesterol? Does anybody want to give me a definition of what cholesterol is? It's a little substance that you find only on animals, on anybody that has a heart. Anybody that has a heart or a liver makes cholesterol. So if that's the case, do you get cholesterol from apples?
No.
Did you get cholesterol from a pineapple?
No.
Well, I went to Shaw's one day, and there was this big sign outside Shaw's that say, Macintosh apples cholesterol free. And I heard this lady reading that sign that said, oh, cholesterol free, I have to get 2 pounds of that. But you see how the media really doesn't educate us and we don't really know what it is? Organic. How many of you guys hear organic? organic, and you go there and the thing is $20 more because it's organic. Does anybody know what organic means? Huh?
It's grown without chemicals.
We hope so, but who's supervising that, right? I'm paying the $20 extra, and I'm really hope that was the case.
I feel the same way.
Right? Right. So anyway, where I grew up, we didn't have any of that, but here we do. So again, to have cholesterol, you have to be a human being or an animal. The smaller the animal, the smaller the amount of cholesterol. So give me some example of animals that you know that might have a little bit of cholesterol.
Dogs.
What about big Doberman?
Coco Keady.
Coco Keady. Yeah. Who else? Pigs. That he will have a lot of cholesterol, right?
What about an elephant?
An elephant. Whoo! He's having a heart attack tomorrow. Right? So the bigger the animal, the larger amount of cholesterol. Why do I say that? It's because many of you need to pick things that have low cholesterol. So if you eat meat, what are you going to try to pick for meat?
Chicken.
Small meats. Like what?
Poultry.
Huh? Poultry. Very good. So besides animals and humans that make these, we also eat the cholesterol that we ingest. Okay? So we don't need a lot of cholesterol to be alive. We have all the cholesterol that we need pretty much being pumped by your liver. So when you sleep, you go to sleep. What time do you guys go to sleep?
Midnight.
Midnight. What, are you partying to midnight? What are you doing to midnight? No, her. Okay. Why do you up until midnight? Can't go to sleep, huh?
No.
No, she can't go to sleep. Okay. Well, she goes to sleep at midnight. An hour after she goes.
Sleep hard.
An hour after she goes to sleep, guess what happens to her body? She starts making cholesterol. Isn't that cool? She starts making cholesterol. So by her liver. Where are our livers? Does anybody know where the livers are? Right here. That's where your livers are. Okay, so you start making your cholesterol when you sleep. That is why, for the people who raise their hands that were taking cholesterol medicines, some of you did, you take it at night. Why do you take it at night?
Because it cuts down, stops it from
It blocks the production of cholesterol. You got it! Wow, you're a smart lady. So, the reason why we want little cholesterol is because excessive cholesterol forms plaque that sticks to inside of the vessels. So with too much cholesterol running around, and again, came from our liver, came from big animals, okay? Little by little, the vessels in our eyes, our heart, our legs, our arms, our belly, our legs will get filled up. And then we can have what? Stroke. We can have high blood pressure. We can have blockage in our legs, blockage in our arms, blockage in our neck. How many of you know people that have had blockage in here?
I've had surgery. I've had an
You
operation.
have an operation, yeah.
Yeah.
See, right to her neck. Okay, and I wish teenagers would hear this you guys saying that, because when you tell this to teenagers, they're like, oh, we'll never have that. That's never gonna happen to us. But it's actually really important to understand that it happens. Okay. All right. So we have cholesterol. So what families do we have? What last name do we have here that you guys like? Oh, what is your last name?
Mine,
Yeah, yours.
Bonanno.
Bonanno?
Bonanno.
Bonanno.
That means good year.
Good, Bonanno. Of course, you're Italian.
Yes.
Bonanno, signora. Tengo bon dia. All right, so we have the Bonanno family, okay? So the Bonanno family, come with me. The Bonanno family brings her daughter, brings her husband.
Hold on to me, because I can't
I'm
see.
holding on to you, darling. She brings everybody, gets up on the scale. And all the Bonanno family weight 600 pounds. All right? Have a seat for a minute. All right, so we say, so what did the Bonanno family weight? Oh, 600 pounds. Well, that's when you look at the total cholesterol. How many of you have been told, oh, your cholesterol's high? How many of you have been told that? Because they're looking at the total number. So after that, I'm going to say, well, no, that's not fair. You weigh her with her daughter, her husband, and all her grandchildren in there. I need you to separate them. Okay, I need you to take Mrs. Bonanno, Mr. Bonanno, little Bonannos out of the picture and give me each one, okay? Cholesterol is made of three things. We have the L, that stands for lousy. Can we say that? Lousy is bad. The lower, the better. Bad, okay? One, what happens with the LDL? Carries cholesterol around the blood, forms plaque in the arteries, and increases risk for heart attacks. So how many of you guys like the L? It's like the bad kid in the family. Everybody has one. Do anybody has one bad one and the kids? You have 5 kids, one of them is a real troublemaker. Do anybody, that happened to you? I happened to me. Any of you? No, you're all very good kids. Perfect, that's great. You're lucky you are. I didn't get that lucky. But, so the LDL is the bad kid of the family, okay? Then we have the HDL. That is the good kid. That's heaven, that's good, that's H. The higher, the better. So this kid, the H kid, is really, really good. Henry is just a really good boy. And the H, what it does, picks up the bad cholesterol, takes it off your body quickly. And it helps us also to prevent plaque in our heart. Okay? So the more H we have, the less L we're gonna have because the H's are taking over. Okay? Again, L stands for?
Lousy.
H stands for?
Henry.
Heaven. High.
What's
Good.
the number?
We're gonna go over that.
Okay. That'll be interesting.
Then the third piece of the puzzle, the third member of the family, as we talked the Bonanno family, okay, is the triglycerides. So those actually the grandchildren of Bonanno family, they're made of pretty much sugar, and they circulate around the body, okay? So when you look at the 600 pound of the Bonanno family weight, you separate them as, that was the total Bonanno family. This is lousy, this is good, and this is the triglycerides, okay? So when somebody tells you, oh, your cholesterol is 300, well, you know what, sorry. Tell me what my good one is, what my bad one is, and what I need to do about it, okay? All right, so these are your normals. So total cholesterol, this is the Bonanno family getting up in the scale, okay? Less than 200. Did you just unplug something, Coletti?
I might have, yes, so sorry.
Yeah, you did. Okay. So 200 is the number that you want to achieve, okay? Now, the L, the lousy, less than 130, less than 130, okay? The good one, as high as you can get, because how many of you want to go to heaven? The higher, the better. Get high, 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 high. Higher, the better. And triglycerides, less than 157, okay? So triglycerides, which is the grandchildren jumping around, throwing toys and being bad, you want really little, okay? The lousy ones, like the back kid in the family, you can only have one that you can handle, right? More than that will give you a stroke. And the H's, you want as much as you want. You can never have too much of a good thing, right? Okay, so again, I'm gonna quiz you. Cholesterol is made out of what?
Fats.
Yes, H, the L,
Heavenly.
heavenly. LDL stands for what?
Lousy.
And then
Triglycerides.
triglycerides. Perfect. What is the number of the total cholesterol? Total. 200. 200. Okay? So we're gonna show you ways today with the help of Uncle, with Chef Eddie. My kids call it Uncle Eddie, so he's Chef Eddie. With the help of Chef Eddie, how to eat healthy. Because not everybody that has high cholesterol needs to be on medicines. A lot of people don't need medicines. It's just a matter of balancing that act a little bit, okay? All right, so I have high cholesterol, so anybody can give me my risk factors for high cholesterol. Why is my cholesterol high? So
Strokes and heart attack.
yes, but you ladies have a little bit of work done to your carotid arteries, correct?
Yeah.
All right, well tell me a little bit what we call it the risk factors, meaning that what puts you at risk to have that? Anything you think of? I know.
Blockage. The blood to your brain.
Right, that was the blockage. What caused the blockage?
The cholesterol built up.
the cholesterol buildup. But what risk factors did you have? Were you guys, anybody knew that smoked that had that problem?
No.
Anybody with high blood pressure that had the problem? Yeah. What about your mother and your father having it?
Yes.
Yeah. What about if you never did anything but went to work, sat at a desk, went back home, sat in front of the TV, got up again, went to work, sat at a desk, went back to,
I wish I
and you did nothing, like no physical activity, right? And then at lunchtime, because you were hungry, you went next door and got yourself a hot dog. Or have a patient that has a burger for the morning, burger at lunch, and a burger for night, for dinner. He spends $3 a day on his whole meal. He has like a $50 plan at McDonald's, and he can eat a full meal, 3 meals a day, for $50. And he was proud of that. He says, look, I have a hamburger in the morning, my hamburger at lunch, and my hamburger at night at bedtime, and I feel great. I said, well, you know what? That's great. But you're gonna have to sign some sort of living will here because you won't be around much longer. Your cholesterol is really, really high. You're eating McDonald's every day, right?
Absolutely.
So a lot of people go because it's cheap and it's affordable, and they forget that it's not healthy. Okay, it's not healthy. No? No. All right. So the next thing is, so we talked about risk factors. Smoking. How many of you know that smoking is really, really bad for your cholesterol? Did you guys knew that? Smoking is very bad. Anybody that smokes has very high triglycerides. Remember the little children that jump around? That's the triglycerides. Those are the triglycerides. Okay. So what can we do? What can we do to make things better? How can we fix these? How can we help our cholesterol besides taking the medications that
Smoking.
quit smoking? You got it. You got it. So, how many of you here smoke? Okay, if you do, you don't want to raise your hand, that's fine too. Okay, because you know you're gonna lunge on you. But it's okay. Smoking, you know, is one of the hardest addiction that human being can have. You could be addicted to alcohol, to cocaine, to heroin, to anything you can think of. But tobacco and nicotine is by far the harder addiction to give up. I have people that are able to run full marathons, 26.2 miles. I know people that have been able to achieve 3 or 4 very high degrees academically, but they can't quit smoking. I have people that have raised 10 children, 10 teenagers at once, but they can't quit smoking. So you're like, whoa, what is that? So remember, the more you smoke, the higher your cholesterol will be, okay? Has anybody here attempted to smoke, quit smoking in the past? No? You have, huh? Well, how do you try quitting? What did you do?
I just stopped.
Good. Just cold turkey, huh?
Cold turkey.
Nice, nice. One day you say I had it. Anybody else? How did you do it?
I woke up one morning and decided I hadn't had a cigarette for 8 hours, so I said maybe I can go 8 more. And that's how I did it.
One day at a time, right? Works if you work it. That's very nice.
Worth it.
Very good. Anybody else? Any other ideas? And that goes for everything. You decide one day that you want to quit, and you quit, and that's perfect. That's very, very nice.
I quit because I worked in the yak gallery up at the Hopkins Center, and because you weren't allowed to smoke, and you know, just upstairs in the snack bar. So I would go, you know, the 4 hours, and 4 hours I figured if I could quit for 8 hours, I would do it. So I just went cold turkey.
Wow. How many years had you been smoking before you gave it up?
Oh, I started when I was 15, I think, yeah.
You know,
Oh,
I
I've been
asked that
smoking
question
for
to a
many
lot of my
years.
patients, and I'm just shocked. Oh, I started when I was 7.
Oh,
I
no,
have an
no.
8-year-old, and if I see her smoking, I'd be like chasing her.
No way,
It's like,
right? No.
I was like, what? You were 7 when you started smoking? How did that happen? And they says, yeah, we'll go in the back and smoke. And my father and mother never knew I did. They were like, wow. And how old are you now? Well, I'm almost 69. I've been smoking pretty much my whole life, right? So smoking is part of their lives now. So the next thing we talk about for diet and to eat healthy is exercise. Well, I have heard it all. I don't exercise because it's cold. I don't exercise because I can't breathe. I don't exercise because I don't have a machine. How many of you here exercise or do anything that requires you to move up and down for at least 10 minutes? Good. What do you do? Tell us.
Just around the house.
You walk?
I can walk from one room to the other.
Nice. What about you?
I work the hallways.
Nice, nice. You?
I snowshoe and I walk.
Snowshoe, yeah?
Same thing.
Uh-huh. Anybody?
Walk.
You walk?
We have
I skied for 25 years, and so I certainly have had exercise, and I have good, strong legs.
Nice. Good for you.
We have exercise classes here 3 times a week.
Wow. How many of you participate on those classes? That is amazing. Wow. And is how long the classes? 1 hour?
1 hour.
All right. So that is a really nice opportunity to get into a place where you can exercise. But what happens if you're home and there's really not much to do there?
No.
What can we do? Well, we have a chair. We all have chairs, right? We all have TVs, do we? No, radios, magazines, pictures, right? We have a chair. So we're going to sit down and we're going to stand up. And we're going to do this for 20 times, all right? And that is a very simple exercise that you all can do that makes you lower extremity nice and strong. How many of you can do that? All right, let's go. 5 times. All right?
Let's try it.
So we're gonna count. All right. 1, 2, 3, 4, and 5. How did you feel after? Good?
Like we've done 5.
Like we done a marathon, right? Right? So how simple that is, right? So the next thing you do is you put a leg into that chair and you bring your body forward. That's another one, very easy, just a chair. Then you hold the chair, you bring your body back, your leg back, and you're making your gluteal area nice and strong, okay? And then I don't have weights, I can't afford weights. I'm gonna have 2 cans of soup in my hand, and I'm gonna do 1, 2, 3, 4, and 5. Is that good?
Yep.
Very simple weights to get things going without spending too much money, okay? All right. Now, so there's some things that we do or some things that we have that we can't control. Can we control the fact that we are either Hispanic or white? Can we control the fact that we're either a girl or boy? Can we control who our parents were? If we could help it, we could, right? Because patients say, oh my God, I got such a bad genes. He gave me the worst genes ever. I got the cancer gene, I got this gene, I got that gene. But you can fight those genes, you know. So the thing to remember is that genes are only a blueprint and you can change things, okay? So the things you cannot change is your sex. Well, some people do, I guess. You can't change change your race. You can't change who your parents were or what genes they gave you. But give me some things that you are able to change that will help your health. Like, what on this group here, give me one thing. What things can you change that will help you? What you eat. Very good. What else?
How much you exercise?
How much you exercise. What else can I change?
How much rest you get. Sleep.
Yeah, how much sleep I get, right? What else?
Stress.
How much stress I have, I can control that. So there's some things I can't control, and so some things I can. So I'm gonna focus on the things that I can control. And that goes for all the diseases. I have breast cancer, my mother gave me the gene of breast cancer, now I have it, I'm fighting it. Can I change that? No, I can't. What can I change? I can change the way I view this disease, and I'm not a cancer. I'm not a person with cancer. I'm a person that's fighting cancer that has other things to do better than dealing with cancer, right? And there's things that I can do to make myself better besides thinking that, oh, I'm fighting uphill battle here and I can't get better, right? So anybody here knows a father or mother of yours that was very, very sick, and this is probably why you got what you got?
My mother died of brain cancer. It's in my whole family.
Her mother had brain cancer, and everybody in her family got it. Anybody here? Anybody else? Did you like those skinny jeans that people get where their mothers are size 2 and the kids are size 2, and this lady eats like he's going out of style, and they never gain any weight? Have you seen that?
Oh, yes.
And don't you hate that? You know, and that's just genes. And there's other people, and I know all of us are, where it doesn't matter what we eat, we always gain weight. So it's almost like no fair, right? Yeah. All right, so let's do these.
Bless you.
Does anybody have any questions so far? Huh?
So see, I have some printed out somewhere.
Mhm.
That would be helpful for you. I'm just trying to find what I did with them.
Yeah. Okay. So the benefits, I have a copy of these handouts, by the way, if anybody wants a copy of them. Okay. So some of the benefits of following a healthy diet is that we will live longer and healthier. All right. So for those patients that had diabetes, and again, who were there? Were 2 here, I think, right? So what do we do for those people? What we're gonna do is, you okay?
I'm fine, thank
Mrs.
you.
Bonanno? Yeah?
I'm fine.
So we're gonna limit how much fat we eat in our food. We're gonna limit how much sugar we have. And so instead of sugar, what can we have?
You mean for a sweet?
Yeah, for sweeteners, what can we put in?
Honey.
Honey is a good sweetener. What else? How many of you like salt in your diet? We all do, right? Why? Because it makes it taste better. If you are diabetic, we know that the number one thing is do not skip meals. Never. If you're diabetic, never skip meals. How many of you know people that don't eat breakfast ever? Ever. I have a patient that actually works at Ruger's who he comes in at, usually I see him around 4:30 or 5 o'clock for high cholesterol every 3 months. It's 4:30 in the afternoon and I say, can I do your blood work next week? And he says, no, you can do it now. I'm fasting, meaning I haven't had anything to eat. So he's gone from 4 in the morning that he got up to almost 4:30 in the afternoon that he came to his appointment with nothing in his stomach. And I said, so how do you manage to get such a bad numbers? Well, I go home and I eat a whole full pizza and I eat this and that, and this is why, okay? So start on doing that. We're going to do what? Not to skip meals. But I get up in the morning and I don't feel hungry. So what do you do when you don't feel hungry?
Eat anyway.
Eat anyway. What do we like to eat in the morning? Something quick.
Cereal.
Cereal. Okay, what kind of cereals can we eat?
Special K.
Special K, yeah. Well,
Cheerios.
Well, I gotta go do my exercise, so I have to go watch TV, or there's something going on upstairs, and I don't have time. So I want to make some easy to go little snacks that we can have. So what would those be?
Toast.
Yeah, toast. Hard-boiled eggs, a little pinch of salt to them, a little bag, ready to go. Celery sticks with peanut butter, right? So we talk about eating healthy food. I don't know how many of you recognize what we have in these tables here. Here. Anybody knows what this is?
Yeah. Beans.
Red beans. How many of you like that? Very good. What else do we have? We have garbanzo beans. This is your protein. Peanut butter. So most of my patients like the Jiffy or the Skippy. When I tell them take peanut butter, they have the Jiffy and the Skippy. But the first ingredient in Jiffy and Skippy is what? Sugar. Oh, my sugars go up after I eat that. Well, yeah, everything says it's sugar. So this is actually almond butter. You can pass it around. How many of you seen
Good.
How many of you have seen almond butter? It's one of the best things that you can find. So I don't have any access to fruit, so guess what? Crushed pineapples. Okay, a good source of fiber. Now I need to add a protein to my salad. I don't know what to put in. We'll put some beans. Okay?
What's
So
that?
this is just red beans.
Oh, you put it in your salad?
You can put it in your salad. Yeah, definitely. Okay? So Chef Eddie has made different fruits and foods here. He's gonna show us a little bit of what he's gonna do on how we can actually change the way we look at things and bring those H's really high and those lousy guys really, really low. All right, Chef Eddie?